This is Johnson Adley, the founder of GalenAI, and I wanted to do a demo of our 3 live products right now, and hopefully we can do more in the future. So this is the home screen. If you go to galenai.co, this is exactly what you'll see, and then you can see our products. You can go here or here, but you can see all of them here. The first product we have is Drug Query, which is, you can think of it as an instant answer to clinical questions without any of the fluff. You give it a question, it gives you the answer. It's truthful, it's reliable, and it gives you where it's getting this information from. The second is, drug chat GPT. Basically, you can have a back and forth conversation about drug therapy. And this is great for situations where you may need follow-up questions to your original query. And the last one is Stewardship AI. So this is a very focused model and antimicrobial stewardship. Basically, you give it an infection and it gives you treatment, duration, and dose, and very quickly as well. So we'll go one by one and see how they all work. So the first one is, the drug query. So let's just ask it a question. We'll say, can vancomycin treat listeria? Right, this is one of the questions I actually got as a clinical pharmacist. If I click search, it's going to go through the vancomycin information. It's going to go through the infectious disease guideline to see if there is any information about listeria, and it'll give you the answer right away. Yes, vancomycin can be used as a second-line agent to treat listeria. And then this is where it got this information from. Some patients may require alternative therapies due to allergies and disease state and so on. And this here gives you additional information from just normal large language model GPT-4. This sometimes is have helpful information, but it's not guaranteed to be truthful. This is guaranteed 100% to be truthful. So this is the first product. And now if you go to Drug Chat GPT, and again, this is based on a real conversation and had with another clinical pharmacist, which was, can I use ketamine in patients with head trauma? Right, I'll put this here. Background here is that, back in the old days, ketamine used to be contraindicated in head trauma because everybody saw that it increases the intracranial pressure. But actually, that is not true. And recent studies have just kind of debunked that myth. And here, exactly, perfect answer that I gave as a pharmacist. Yes, you can use ketamine in patients with trauma. It was traditionally contraindicated, right? But it's not contraindicated anymore. And then you can have follow-up questions here. What's the dose of ketamine if you want? Can I use propofol in that situation? And so on. It's a back and forth conversation. And the last product we have is Stewardship AI. It's basically straightforward. You give it an infection and some optional patient demographics if you'd like, and it would give you the treatment, the dose, and the duration. So if we try, for example, we'll keep it simple for this demo. Let's say, for example, UTI. Typical UTI 35, or let's just say 75 kilos, and we can keep this stuff optional. And if we do this, it would look through the urinary tract infection, and it will give us a good drug therapy dose, duration, and treatment. Here we go. Nitrofurantoin, microbid, 100 milligram twice a day, 5 days, or Bactrim. Perfect answer, the same answer that I would have given. And that's basically all the products that we have right now. We have a few things we're working on. You can always use it in your own data and explore your own use case. Always feel free to reach out. There are a limitless amount of use cases and potential for that kind of technology. Thank you.